It's been a real pleasure for me to work with the chairman of Energy and Commerce and Labor in putting together this plan. It hasn't been easy, but it's been really an educational process for all of us. And to be working in the shadows of John Deagle's dad and recognizing the historic work that he's done over the years in the health reform system just reminds me of how many politicians, members of Congress, and presidents have said that they're going to do something about reforming our health system. And now, for the first time, the president has pulled together all of the stakeholders, all of the people that have fought against this over the years to come together and to recognize that we have to do it for our country, we have to do it for our citizens, we have to do it for our economy, and we have to do it if we're going to remain competitive. Everybody has a story, a horror story, of somebody that was under insurance, didn't have insurance, didn't know the cost of the insurance. People refuse to leave their jobs because they can't afford to lose their insurance. Bankruptcies, foreclosures, all of these things because of the high cost of health insurance. And where was America? Behind all industrialized countries, paying twice as much for insurance and not getting access, not getting quality. When the committees get together, it's no small task, and we haven't finished our work. But we thought it was important enough to the members that they know what are we thinking about. We've had hearings. Every committee's had a half a dozen hearings, and yet there's still members on the floor that have problems in understanding the difficult decisions that have to be made in modernizing the system and paying for the system. But we thought that America should not have to wait, that we want to get this discussion draft out there. We want to get the maximum support for this so that doctors and health providers would know that we're sending all of these resources out there in order to have a healthier and stronger America. There is no question that we will be saving trillions of dollars in the industry, stopping the hemorrhage that's there, having employers to feel that they can do what they always wanted to do, and that's to give some assurances that their workers will not have to worry about the health or their health or the health coverage for their families. Small employers that wanted to do it but couldn't afford to do it will be provided incentives. Poorer people and working people that are under insurance and have no insurance, that are dependent on emergency rooms, will now know that they can negotiate a health system. And then to have a public health program, an option, so that they're not captive of the large insurance companies, but able to talk with them and compete and say that if you can't give me what I need, I can go to the exchange. I can go there and deal with the people that perhaps would give us a better chance. Is this going to bring down the cost of health insurance? You bet your sweet life. I can't wait to talk to anybody that's fighting against this public health insurance programs. It's going to be competitive. The health information technology is going to force them to provide more options for people. We're sending out there 48 million people that had no insurance, and they will have in their negotiating hands for the insurance companies to compete with subsidies in order to get insurance. Half of the people who've been underinsured will be able to negotiate. So what does that mean? It means providers will be able to know that the government is a friend and a partner of everyone seeking health insurance. And so the industry is going to provide new jobs for the providers, nurses, doctors, primary care doctors, centers, so that communities that never had access to health care would be able to do it. It's going to mean a stronger financial country, it's going to mean a stronger health country, and it's going to be a strong moral standard that we will be setting in order to do what we should have done a long time ago. What an honor it is for me to present to you John Dingell, because I told him this afternoon, his dad has to be looking down on him saying, John, it's just about time. Because for all of the years that he spent in this Congress, He can tell you the numbers of presidents that have said, we're going to do it. But this time, on his watch, the Dingell bill will be coming out, and it's my pleasure to present my mentor to you, John Dingell.